Okay, good morning, everybody, ladies and gentlemen. Welcome today. Firstly, I'd like to take this opportunity to thank the Department of Employment and Labour for availing Mr. Pumudzo Mapaha, the Director of Construction, Explosives and Major Hazard Installations, and Mr. Hilton Ganesan, who is the Deputy Director Specialist for Construction, for this virtual clarification that we're going to share. Sorry, technical glitches. For today's discussion pertaining to the COVID-19 guidelines that were issued. I'd also like to take this opportunity to thank the panel for your attendance today. We really appreciate everybody's attendance. And then we're going to go through the presentation with a few, let's say, items on the agenda. I've tried to put it more into a formalized format of an agenda that we can go through. And yeah, please feel free to stop me at any time. I will do my best to chair this process in the most best and professional way that we possibly can. So just quickly, if you don't mind, just a quick introduction. We can start with Dr. Carmen James. Just a quick introduction, please. Dr. Carmen James.
Hi, good morning, everyone. Can you all hear me?
Yes, we can.
Morning, yes.
Go ahead.
Okay, good morning. I'm Dr. Carmen James. I'm an integrative medical doctor and health coach with a special interest in lifestyle medicine. And I'm very, very pleased to be here with you all this morning.
Thank you very much, and thank you for being with us. Next is Fadli Valley. Fadli. Okay, I don't know where's Fadli. Next we have Dr. Telefo Moyo. If you can please just give a quick introduction, Doctor. Hello. Can everybody hear me?
Yeah.
Can you hear me? Okay. Don't know why are the guys shy today. Next up,
sorry, Fabian, I see Fadli is on mute, I think. Maybe they are on mute, I'm not sure.
They can just unmute their devices and then they can speak. Okay, but we'll just give the others an opportunity so long. Next we have Joseph Makuvele. Hi, Joseph.
Good morning, everyone. Fadli, I said my name is Joseph. I'm safety advisor with Saudi Aramco in Saudi Arabia.
Thank you. Okay. Next we have Dr. Vali. Dr. Vali Labaskakni.
Hi, good morning, everybody. I'm Vali Labaskakni. I used to work for years of safety retirement. My portfolio at CESOL was at first general health. Trying to occupational health in project specifically.
Thank you. Thank you, Dr. Vali. Okay, next we have the monk, Menderoy.
Morning.
The monk. Okay, the monk is not coming online. Next we got Dr. Sibongi Seni, also known as Dr. Seni.
Good morning, colleagues.
Morning.
I'm Sibongi Seni Mieni, an occupational hygienist in private practice. I work in different sectors of the economy, providing occupational health and hygiene services. Thank you.
Thank you, Doctor. Next, we have Mr. Warren Manning.
Morning, everybody. Warren Manning from Durban, some kind of OSH practitioner. And yeah, that's about it from my side.
Thank you. Next, we got Saeed Mansoor.
Hi, good morning, everyone. Very passionate about people, so I'll leave it at that.
Okay, thanks. Thanks, Saeed. Okay, next we got Gerard Geyser. Sorry, I didn't edit this one. Excuse me. Mr.
That's
Gerard
fine.
Geyser.
Good morning, everyone from Legricon, legal consultant and risk consulting. Yeah, I think I'll leave it at that.
Thank you, Gerard. And next we got Advocate Hendrik de Blanche.
Hi, good morning, everyone. Yeah, Hendrik de Blanche from Legricon, also legal consultant and risk advisor.
Thank you very much, Hendrik. Next we got Mr. Pumudzo Mapaha. Hi, Hilton. Is Pumudzo on? Okay, I guess he's not on as yet. People are still joining, so I'm still adding them. Next, we have Mr. Hilton Ganesan.
Good morning, everyone. Hilton from the Department of Labor Head Office in Victoria. I'm the National Construction Manager, focusing on the construction regulations. Thank you.
Thank you, Hilton. I think you're going to be one of the center of attraction for this discussion. Your mic is slightly soft. I don't know if you can maybe adjust it. Obviously, because we would like to try and get the best audio out from your side, especially. Thank you, Hilton. Next, we have just Ernst van Bouillon, excuse the pronunciation, and Liani van der Walt.
I don't know, can you hear me?
Yes, yes, we can, loud and clear.
Good morning, my name is Ernst van Bouillon. I work for a company called LCS, which is a law firm specializing in occupational health and safety. We do a lot of training, consulting, and we're also very passionate about the situation. And we want to know what is going on with Corona.
Thank you so much. We're all in the same boat. Thanks.
I gather that.
Okay, so without any further ado, we're going to go on to the meeting agenda. I know there's many others, so please, again, these were invitees on the panel. Please mute your devices, if you don't mind. Okay, we're going to go through the meeting agenda quickly to discuss the questions shared with the Department of Employment and Labor and allow for an answer from the department, answer sessions between the departments, etc. We'd also open it up to the professional panel if there may be any questions from the answers to allow for a brief discussion on the topic. We obviously want to try and limit the amount of discussions, but I believe that discussions are healthy on the topic. So we will try to keep to the hour. I know that Hilton has another meeting scheduled. So we obviously want to keep to the hour that it's been scheduled for. So the next is the additional points is to discuss the role of the OSH practitioner during this COVID-19 pandemic at the workplaces. And then we will close the session. There'll be a close and vote of thanks. So again, just the points that were put on, we would like to understand, ask, and speak up. That's the objective of this session today, this virtual session. So before we go into the questions, if I may ask Hilton, if you can please just give a short high-level explanation on the guidelines that have been shared, if you may please.
Okay, guidelines in respect of the construction sector guidelines, which is in the draft, and then we've got the OHS directive. So I just want to confirm the OHS directive is still applicable, and I know there's a lot of questions around the OHS directive, and we're currently in the busy of drafting an amendment to that directive, which is delaying the sector guidelines. Some of you guys are aware that I did circulate the sector guideline, my draft sector guideline, to most of the stakeholders for comments. And there were a lot of comments. I took most of them into consideration. The draft is not a confidential or private copy. It's available, whoever wants it. You can see what I'm proposing on the construction sector guidelines. And yeah, so that's where I am at the moment. Remember, the OHS directive, it's coming part of the Disaster Management Act, Regulation 16.6, which is obviously very consolidated. So what we did was we expanded on that and created the directive. the directive, which is somewhat prescriptive. It does have some loopholes, which I'm going to admit. That is why we redoing that draft or amendment to that. And as mentioned, once that's sorted out, that's only when I can release my construction sector guidelines.
Okay, thank you so much, Hilton, for that explanation. Okay, we'll dive right into the questions because that was also our main objective, is to ask a couple of questions. So just some history. Some of these questions have obviously been asked on social media platforms. Some of these questions we've come up with thoughts of ourselves, especially from the panel side. So again, some of them might seem like a bit of a naive question, but again, it's for the benefits of the public from this session that we have today, that they can learn more and understand based on the, let's say, the ambiguity that some see it as at the moment. So if I may, question one, use of the breathalyzer machine, is it still safe to use under the COVID-19 outbreak? And sorry, it's directed to you, Hilton.
Oh, okay. I remember the use of the breathalyzer machine, the first was the police department to suspend that breathalyzer machine due to suspected transmission of the virus should that machine be used. But in terms of a guideline or something that's legislated, there is nothing that's directly indicating that you should not use the breathalyzer. It has to be done in accordance with your risk assessment. So you'll have to obviously identify your risk and use the appropriate testing machine. So on the same question, I noticed that you guys indicated that if we can use a disposable one-time test rather than an alternative. Yes. So that the answer is yes. It's going to depend highly on your organization or your risk assessment. And that goes on right till the end of these questions as well. So we do not waste much time and we can focus on other issues that need clarity. Remember, one of the challenges is we cannot make a regulation prescriptive because it's not going to be a one size fits all. So what's really highly variable is your risk assessment specific to your organization. On that as well, like I know along the questions is the issue of a cloth mask, a highly flammable area. Remember, it's has to be dependent on your risk attached to your workplace, and that goes over to PPE, which will come later on with.
Okay, thank you for that. Are there any follow-up questions from the panel, or can we proceed to the next question? And I'll take silence as a no.
Yeah, sorry, Hilton, Fabian. I just want to, if I can, just add. I mean, alcohol cannot be sold anyway at this stage, so you know, I don't know if there is such a big risk of intoxication at the moment. So my advice would be to most clients is, for the time being, don't do breathalyzer tests because people can't buy alcohol anyway.
Besides the pineapples, besides the pineapple tops that they're brewing at home. Okay. So if there's no other questions on that, we move on. Question 2, COVID-19 waste, how is it classified?
Okay, this one, there was a Department of Health guideline, environmental guideline. Now, Fabian, there are lots of documentation that I'm going to make reference to. So I can email this documentation after the presentation to whoever need, obviously, substantial proof or reference to whatever we discussed today.
Thank you, that'll be perfect.
So in terms of the waste, there is a directive, or there was a direction by the Minister of Environmental Affairs. I'm just trying to find that document, which classified the waste as hazardous waste, right, in terms of the schedule. And that's going to fall under the SANS codes, right? So meaning that it has to follow the procedure under the SANS code in respect of disposing the waste. So even if you've got PPE on a site and you're disposing the site, the code is SANS 10248. That's the code that we'll be using to dispose this COVID-19 waste. Now, why it's classified as that? Because it's associated with the as out waste or medical waste or bio waste. So what the minister classified it as just hazardous waste in abbreviation HW in the document that was released.
Okay, thank you. Thank you very much.
I will email that document to you.
Fabian?
Distributed.
Yes. Is that
Fabian?
Fairley? Hi, Fairley. You got
Yes, Fairley.
a follow-up question on that?
Now, I just want to find out, so it sends 248 if I'm correct, eh? That Hilton is saying.
Yes, yes. Sense
Okay.
10248.
Thank you. Thank
Okay,
you.
thank you. Okay, so obviously that answers the follow-up question as well. Question 3. So companies who conduct the decontamination and disinfecting process for COVID-19, do they need to be approved by relevant authorities?
Okay, yeah, so remember this one is separate from waste. Huh? This one is the decontamination and
Disinfecting, yes.
Yeah, so this one here, our directive and including the disaster management regulation. Remember there was 2, right? So the 29th April 2020 disaster management regulation, it repealed the initial one basically. So both the regulations does not make a difference to an accredited or approved person to decontaminate or disinfect. So I know there are some legal persons in the panel as well. So if something is not prescribed or legislated, then I'm not going to say that you have to use an approved person for this function to decontaminate and disinfect. But please don't misinterpret me. There are companies that are approved for this purpose. But it's just that it's not under Disaster Management Act in conjunction with our OHS directive.
Okay, thank you. I think that answers it perfectly. Is there any follow-up question?
Fabian?
Yes,
Fabian? Just to clarify the previous thing on the SANS code, it's SANS 10248, not SANS 248.
No, you said 10248. Yeah, I've written it down.
Yeah, because,
SANS 10248.
Yeah, because there's a different code which is SANS 248.
Yes. Now you did refer to 10248.
Cool.
Thanks, Warren. Okay. On to the next question. Question 4.
Sorry, just Fabian, on the decontamination and disinfectant, the subcontractors can actually use their own internal resources for cleaning. Would that be an issue?
You mean internally within the company to clean the area?
Yes, to disinfect.
No, that won't be an issue. It's not legislated that you have to get an external person or accredited person or an approved person
to perform that. Okay, thank you for that. Okay, question 4.
Sorry, I didn't hear that, Fabian. You need an external person?
No. Hilton mentioned that you do not need an external person to do it.
Okay.
Or an accredited, let's say, company. Okay, next is
Thank you.
Question 4. Section 23.2.1. Isolate the worker, provide the worker with an FFP1 surgical mask, and arrange for the worker to be transported in a manner that does not place other workers or members of the public at risk, either to be self-isolated or for a medical examination or testing. The question was, how is the section interpreted in terms of sending people home? And does the employer provide their own transport for the employee who presents symptoms? So I think this question is linked with regard to the first point.
Okay. Yeah, I also stumbled on this question as well. Remember, what this is that the employer must arrange for a worker to be transported in a manner that. So, apart from this, it's quite self-explanatory. I guess the question is posing on how the transport, so does the employer, because I see that coming later on as well, does the employer use his own transport? Does the employer get a taxi? Just even if it's along that lines. But I really don't understand what the question is intending to seek clarity on.
I don't know if anybody else wants to jump in, but from obviously again some of these, as I mentioned, are from public social media. So the intention was that what is the take on the from the department side with regards to if a person is found to be, let's say, positive or showing symptoms, is there a guideline or guidance as to how this person needs to be transported? Are we saying the company needs to provide a transportation, have special PPE provided to, let's say, the driver, etc., in the vehicle, or do we just allow the person to go out and possibly infect the public during their transportation home if again this person is suspected to be positive, COVID positive?
So the onus is on the employer to ensure that the affected person who's suspected to be isolated, or if he's transported home, the onus is on the employer to ensure that he meets the prescriptions of the directives or applicable terms of transportation. So that was the intention of Section 23.2. Obviously, if a person is suspected, we don't expect the employer to just send the person home and start infecting other people. There have to be some sort of a guide or regulation that the employer must adhere to. So that can be any form of transport, his own transport or public transport. You just have to adhere to the regulation in terms of transportation.
Okay, thank you.
Sorry, Fabian. Yeah, Fabian, just from the previous cases during the lockdown with essential services, where, for example, persons showed symptoms, have we gathered any learnings from those to actually support the construction industry? Hilton? I mean, we had a number of cases that occurred in the essential service sector. So did we gather some lessons from there in terms of managing this process?
I think that was the intention here. Remember, at the initial stages of the lockdown, we did not specify the procedure when someone is affected, especially an employee. So the intention here was that we follow some sort of a prescript to ensure that if someone is affected, that they do not obviously infect someone else, and they take the necessary precautions in terms of the other associated regulations to ensure that that person is transported or exited workplace safely and follow the quarantine and test result procedures.
Guys, I'm very sorry to interrupt there, but Hilton, your sound is not very good. I don't know if it's just me. Are there other people also complaining about this?
Yes, it goes off and on slightly. It gets softer and louder.
Thanks, Hilton.
Technical difficulties. No, but it's fine, Hilton. As a safety, as additional clarification, even after this goes out, we can always share based on what you've discussed. We don't want to send out information that's incorrect as well. So, okay.
If I could follow up.
No problem. Can go ahead, Warren.
Just the one concern I have is that 23.2.1 creates a point where there must be a decision made whether the person goes for self-isolation or for the medical examination. So that would be the employer's decision on which part the person takes, is instructed to take, because you'll have to justify why you sent a person after the screening to go home on their own or to take them for testing, if I'm making any sense there. Thank you.
Okay, I think we're going to come to that one later on, where the Department of Health promulgated a checklist together with our department, the Department of Labor as well. Just a general checklist for the compliance officer or the compliance employee to pull in, like a fever, headache, and other related symptoms. So the Department of Health called them symptom screening on a separate guideline altogether. And then the result of that symptom screening would obviously result to what Mr. Menin asked was, how do you determine whether that person should be sent for further testing or medical surveillance, which I'll elaborate later on as well on the testing and medical surveillance.
Thank you for that, Hilton. Okay, let's go forward. If we can obviously get an answer on that point as well later. Question 5, section 31.1. Provide each of its employees free of charge with a minimum of 2 cloth masks which comply with the requirements set out in the guidelines issued by the Department of Trade, Industry and Competition for the employee to wear while at work and while commuting to and from work. So the point was, cloth masks are definitely not meant for hazardous chemical substances in areas such as refineries. These masks cannot seal properly and can allow ingress of pollutants through openings above the nose and through the material, as it is not designed for that. Will it be correct then to say cloth masks are not effective in these areas? Reference should be to the risk assessment or even task risk assessment, which will indicate individual hazard, consequence, etc., and relevant respiratory protection required according to the needs analysis. In a way, it's asked and answered in a way there, Hilton, but I'll allow you to elaborate a bit more.
Yeah, I think on the first question, I elaborated on this one as well. But
Okay.
just for reference purposes, if you look at the preamble of the OHS directive, and if you look at our Department of Employer and Labor guidelines, there's it's quite clear on point 4.4. It says PPE is selected based on the hazard, and then also when you're looking at the disaster management regulation, point 5.3, it says appropriate mask, and then that goes on further to my discussion on risk assessment. So in terms of determining your PPE, obviously a cloth mask won't be appropriated in certain areas, and depending on your risk and hazards identified, these will be variable. So as those other two documents I've made reference to, it's also indicated there as well. This is risk-based.
Okay, thank you very much. Any follow-up question on that from the panel? Can I proceed?
Hi, Fabian, just
Yes,
one
sir.
question. Is there a specific sense code that these masks needs to be manufactured against, or is it just as per the guidance?
Okay. There's somewhere along this question, somebody asked about accredited PPE. Now, this medical surgical masks, those are the SANS codes. Those are governed by the SANS code. I'll just give you that code now. It's SANS 1866. That's for medical PPE. And then the other PPE must be SABS approved.
Okay.
So those are the codes governing PPE. And then obviously we've got the current PPE for COVID-19, such as the cloth mask and stuff. Those are not governed, not regulated, no SANS codes. But there was a directive issued by the Minister of Trade and Industry on how cloth mask, or basically he issued a 3-page directive on
the guideline
of these masks. So if you guys do not have that directive, I'll obviously email it to Fabian as well.
Thank you, Hilton. Okay, let's proceed. Let's go on to question 6. The COVID-19 guidelines classifying worker exposure to SARS-CoV-2. This section gives classes and are risks for occupations, but how it was determined is still not clear. Please, can you clarify this?
The guideline, remember, there was a guideline issued by our department, not the OHS directive. It was the work plan preparedness. So on there, I'm not sure if you guys have a copy of that. It's available on the government website as well and our website as well.
Okay.
And on there, they classify under chapter 3. I'm trying to share my screen, but it's not working. It will just
Sorry, wait. Let me allow you to do that. I'll stop sharing and then I'll allow multiple sharing. And then you can share yours as well, Hilton. Sorry, I should have done it from the start. You'll be able to share now.
Can you see my computer screen by any chance?
Yes, we can. You can see your desktop.
Okay, cool. So I'm just going to go into that document. So it's just going to be easier to explain it directly from those documents.
That's fine.
Okay, can you see my, I can't see my screen, so I'm depending on you guys. You can see my screen there, my computer screen?
Yes, yes, we can.
This workplace preparedness plan, this was released in April. I'm not sure if you guys are familiar with it. Now,
I haven't seen a copy of that.
We've got the contents. And if you look at number 3, it talks about classifying worker exposure.
Okay.
Now, it goes into detail. Obviously, we're not going to have time to go into each into the classification. But, you classify them in terms of lower exposure risk, medium exposure risk, high exposure risk, and very high exposure risk. Now, there was a separate documentation that we created specifically to assist classify workers. So that's a separate guideline altogether on how to classify or specifically assisting to understand how to classify or work in terms of that. So I trust that answers that question. It's fairly self-explanatory if you read this document and if you read the guideline on classifying employees in terms of that.
That's fine. Thank you. Right, I'm just going to share mine again. Can everybody see my screen?
No, not at the moment. Still seeing Hilton's.
Okay, yes.
Yeah, you can see it. Okay. Okay, thank you. So I think that answers that question. Thank you very much, Hilton. Question 7, the analysis of COVID-19, excuse me, analysis of COVID-19 direction on health and safety in the workplace issued by the Minister in terms of Regulation 10.8 of the National Disaster Regulation. What is its legal standing currently? Hello? Can everybody hear me? Hello, can everybody hear me? Okay, sorry man, let's get back. Sorry, okay. So question 7, I'm not sure if you heard me, Hilton, and if you answered already. I was wondering why nobody is talking to me for about 2 minutes. So
Yeah, you did answer it. Yeah, fine.
Yeah, as you answered it. Okay, perfect. Okay, question 8, 16.9, it must be provided, it must provide workers with information, that raises awareness in any form or manner, including where reasonably practicable, leaflets and notices, where to go for screening or testing if presenting with the symptoms. The question was, should a company representative be responsible to take them, or do they go alone for the relevant testing and screening?
Okay, Fabian, this is one of those questions, it's quite self-explanatory what's on the regulations. So I'm not getting much what clarity they're requiring. Remember, it's information, advocacy, sharing, and so forth. And then you have to designate a compliance employee if it's a small supermarket. And then the disaster management regulation goes on to say designated compliance employer, officer. And then our OHS directive goes on to say designated COVID-19 manager. And these are one of those.
Just a quick one. In a nutshell, normally the COVID-19 manager can either do it or they can designate.
I lost you there, Fabian.
Sorry, I was saying in that regards, question 8, would it be fair to say that the COVID-19 manager or his designate could assist or go with them for their testing and screening if they're presenting symptoms at site or at the workplace, excuse me?
Yeah, remember the question is asking if this is information sharing and it must be expanded on the employer's risk assessment. As I said, this is one of those questions that is ambiguous to me. But as I indicated, there's 3 different levels that you're appointing. Remember, under disaster management regulation, you're appointing a compliance employee to assist you. And then also under disaster management regulation, you're employing a compliance officer, which will come later on to assist you with the work plan. And then under C19 OHS directive, we make reference to a manager. And then the information sharing, advocacy, and awareness, I mean, that should be self-explanatory, or unless I'm missing something on this question.
No, it's fine. If you feel you've explained it and there's additional information that can be shared with the people, then no problem. We will share that information for additional clarification if need be. Okay, we'll go on to question 9, social distancing measures. So 17, I think this is a quick one to answer as well. Minimum of 1.5 meters between workers. CF indicates 2 meters mandatory as per Department of Health, risk adjusted strategy level 4 and COVID-19 guideline that was dated the 19th of March also indicates 2 meters. So what is the stance from the Department of Labor? Should we comply with the 2 meters or is it the 1.5 meters as per the guideline?
So we're going by the Disaster Management Act, which is 1.5 meters. And remember, that's the, what can we call it, the Mother Act for now. The Disaster Management Act read with the regulation, the one on the 29th of April 2020. Now, going to 2 meters, remember, if you're saying your minimum is 1.5, and then now we're saying now Department of Health or any other employer for that matter says 2 meters, that's going to fall under best practice. You're not undercutting, we're not going below the legal standing in terms of the 1.5 meters. But basically, the minimum is 1.5 meters under the Disaster Management Act, and you can get this under Chapter 4, Regulation 5, Bracket 4C.
Okay, thank you so much. Is there any follow-up question on question 9? Everybody happy?
Happy.
Happy. Thank you. Okay, next question 10. Symptom screening 6, 21.1, screen any worker at the time that they report to work. Why not over tele-screening as symptomatic person should not travel? CF 16.4 and 23. That was the question.
This is one of those questions, it's like somebody is asking how long is a piece of string. No, seriously, remember what the question is asking is that why don't we telescreen, or why don't we, basically they're asking us why don't we preempt, which is it's just not practical. What we're saying is that we'll screen the worker at the time that they report duty. Remember, before they come to duty, we might not know their medical condition unless they've got a medical certificate or they've got a medical letter indicating that they do possess or they do have some of these symptoms. Then this question will make sense. But preempting symptoms, that cannot be done. You have to report to duty, then you'll screen, or if you have a medical certificate, then that will suffice before you come to work.
Okay, if I may jump in there, thank you, Hilton. Just something that we've done from our side here in India is that we allowing the workers to do a self-declaration form from their home states or wherever they are as well, which also has a kind of a checklist that asks certain questions pertaining to, have you been in a COVID hotspot area? Have you been in contact with somebody that's COVID-19 positive, etc.? So I don't know, that's maybe a possibility that the companies can consider something to that extent, which can also reduce people traveling if they, let's say, are seen as a high risk based on the checklist criteria or the self-declaration form that they're completing. So again, it's just a suggestion or point that could be considered for the revised guideline, if that's something that you could consider.
Thank you, Fabian. Fabian, there is something already out that was released by the Department of Health on the 1st of May. It's a checklist, just like the one you mentioned you guys are using in India. So I'll circulate that to you. That's basically a checklist that will assist before an employee comes to work or even while he's at work. These documents are making reference to, just for ease of reference, if you go to www.gov.za, all of them are there in order: regulation, directions, guidelines, and so forth. So there is two types of checklists that's released by the Department of Health. One is a walkthrough risk assessment released on the 1st of May. And then there's another 3-page risk assessment released by the Department of Health on the 17th of April, and that's also a South questionnaire similar to the one you made reference to. So thank you for that. It makes good reference and it assists as well in terms of the pre-symptom screening.
Thank you, Hilton. Is there anybody else on the panel that would like to share, or can we proceed?
Fabian, I'm not sure if you can hear me.
Yes,
with regard, you can hear me.
And you can go ahead, Doctor.
Okay. No, I'm just worried about this screening of workers at the workplace, because the guidelines refers to 2 types of symptoms. It's just that I don't have the document appropriately next to me here. But the first one is according to COVID-19, and the second one is body aches and other underlying causes. So exactly now, if you incorporate all in one screening procedure, it becomes so difficult, because one way or the other, an employee can have one symptom. And when you have one symptom, it does not automatically mean you cannot access the workplace. And I'm not sure how best we can address this one, especially on the screening procedure, where the department have highlighted 2 different symptoms in a document. And then if one person have got a headache, and then automatically it becomes a high risk.
I support your statement 100%. You know, the challenge I'm having is there's a lot of documents released for COVID-19 as well. And the one that the speaker made reference to, if I'm not mistaken, that's the one released on the 12th of April 2020. That was a guideline for symptom monitoring and management. So I do share your sentiments there as well, that having 2 different symptoms on a checklist, so it creates some difficulty for the employer and employee as well.
Okay, thank you for that. I think it's quite clear. Any other questions based on this question, or can we proceed?
I've got questions on behalf of clients where they say they don't know if a person tests for all these symptoms, and if he has, let's say, more than one symptom, are they supposed to keep him out, or is the temperature the ultimate guideline as to what is going to happen with that person? I don't know if anybody can help me there.
Okay, that's pretty much more of a medical question. I did see we had some medical professionals there, but I'm just making reference to what our OHS directive says that if
Okay, one of our, sorry, Elton, if one of our doctors can also jump in there, if they can advise, if they know the correct guidelines or information, can also step in to assist. But Hilton, it's up to you.
Okay, can I say something? From a medical point of view, not any one symptom would be the deciding factor or would be the ultimate criteria. And one would look at the whole picture and assimilate the symptoms that the patient has, and not necessarily whatever combination he or she has, and then make a clinical decision based on that. So I don't think for a medical person that would really be a problem, because that is the way in which any diagnosis is made. The problem comes in application of these guidelines for people who have not got the necessary depth of specifically medical knowledge, and there it'll have to be a thumbsuck. You can't say go by this ultimate criteria and that criteria, and this symptom is more important than that one, and so forth. So the answer to that question is difficult. It depends on interpretation based on medical knowledge. If you don't have that medical knowledge, then you will have a problem. And that's basically the best answer I can give on that.
Thanks, Dr. Ole.
Thank you very much.
Fabian?
Yes, Dr. Tleka, go ahead.
Yeah, just coming exactly to what the Dr. Ville has been clarifying. This is a really deciding factor of whether an employee will access the building or not. So now, people that are conducting the screening are not medically trained personnel. So now, if I have one symptom, what does it mean? Does it mean I will not be allowed on site because I cough, or maybe my eyes are red because yesterday I did not sleep well, or is because maybe I just have a headache, and then for that nature, then it means then I cannot access the workplace. Or if I feel tired, and it's only one symptom according to the screening checklist, does it mean automatically I cannot be allowed in the workplace because I don't meet the screening criteria?
Well, if you have a babalas, you can meet about half those criteria.
I was waiting for somebody to say that.
but there's no alcohol available.
Hey, pineapple tops are available, guys. Come on. Okay, thanks for that little bit of humor. Yeah, so
Can I add in as well?
No problem, Martin. Go ahead.
It's a big concern, because there's even talk I've seen in documents that a receptionist will do the screening, or a security guard will do the screening, and I mean, how does the National Health Act regard screenings? So it's a web, and some kind of clarity in terms of the screening tool and consistency or standardization. So there isn't. So we're all on one page would be appreciated. Thank you.
Thanks, Warren.
Yeah, I think, sorry, Fabian, from my perspective as well, I think this is probably the most tricky question of them all, and I don't know if we will get an answer. I just went to look at the legislation again. So at one point they talk about any of the symptoms, but when they talk about not allowing the person to work, they talk about symptoms. But I mean, like the doctor said, you can have two symptoms, but I mean they're not indicative. It could be due to other reasons. So yeah, I don't know how employers are ever going to do this and comply with this, because I mean, we have to think like most people, because there's reasonable suspicion, and we all can't have doctors there to say, listen, okay, your symptoms are because of this or because of that. So I don't know how one can actually move on from this point and say, how can you reasonably comply and say, okay, now the guy has one symptoms, two symptoms. When do we refuse him?
Yeah, I suppose the practical method to follow would be that if there is a doubt, or if there is uncertainty at all because the patient exhibits one or two or more symptoms, that he be taken to a place where he can be assessed, whether you call that assessment screening or diagnosis is another question. But where you can be assessed further by people who do have the necessary medical background. But of course, that puts a strain on the resources of the medical availability.
Because I think on Warren's point as well, I mean, screening, it doesn't have to be a doctor. I mean, it's a questionnaire. The person declares whether he has symptoms or not. So I don't think one has to worry about that component. But I think the next step is critical in saying, okay, the guy has now answered yes to one or more of these questions. What do we do now?
Hendrik, Fabian, can I come to Hendrik?
Yes, no problem. You can go ahead.
Yeah, yeah. The thing is that I've managed to review a few documents coming from contractors, and all of them, they stipulate one thing, that anyone with any symptoms that related to the document will not be allowed in the building. So if, like Dr. Ville have highlighted, that one symptom does not mean you cannot access the workplace. So then if the document says if you have any of these symptoms, you will not be allowed on the building, then you are going to have maybe half of your workforce not coming to work because of that.
That's winter now, yeah.
Yes, exactly.
And that other thing, just to add perhaps, is that we're coming up to flu season. And so, you know, even more people are going to be ticking those boxes. But I think, you know, even in clinical practice, you know, what we're seeing in the clinics, I've had patients who suspected that they may have been, people for investigation for COVID-19. And, you call the NICD, for example, and they don't meet the criteria for testing. So I think that as testing becomes more widespread, it's going to become easier to be able to access those resources. But I also think it's important to be able to have a relationship with a medical practitioner that can give you that clinical insight. Yes, I think that is important. And whether that's a local clinic or if it's a practitioner that's responsible for your company, I think that conversation needs to be ongoing until such a time where things like drive-through testing, for example, are readily available.
That's true. Thank you, Dr. Coleman. Yeah, and I think pertaining to that, a lot of companies or countries as well are going into the tele-screening process where they have doctors behind screens that they could possibly assist, as you're saying, on a consultancy basis. So that is something that I think the larger companies must probably will consider. I don't think the smaller ones will be able to afford it unless the Department of Health can maybe make some of those doctors available for that purpose. It might be a suggestion for them to consider.
And maybe just to that point, Fabian, sorry, lastly, I do know that there are talks of developing workplace screening. I don't know if you've seen the predictions of the peaks that are coming in South Africa. Yeah, and so I think that I've been in communication with a few people who are actually setting up these programs to be able to roll out nationally workplace screening. So I think that in time, it's actually going to improve. But obviously, until then, we kind of need to make our own plans, I think, within our own spaces. Yeah.
Okay. Thank you so much, Doctor.
Sorry, I don't think the big companies will have a problem with this, who have doctors on site and full-time occupational health practitioners. But the problem will be massive with small companies who do not have this, and
capacity.
They've got set of symptoms. They don't know how to interpret it, and they may well over flood the available guys who can assess the whole situation accurately. Because you cannot, I think it must be stressed that these guys must not work on one symptom. If you work on one symptom, then as Telefo has said, 3/4 of your workforce is going to sit at the very long. This is a very difficult thing to practice. It's logical to lay down and logical to suggest, but very difficult to implement and to govern.
Yeah, I think just once again, we can talk about this probably the whole day, but my concern or issue with this requirement also is the 14 days or so that you are asymptomatic. So I mean, a person can come to work, do not show any of those symptoms, but is bringing the virus into the workplace. So you still have the risk of workplace transmission, which this legislation is aimed at reducing. and yes, I understand we're filtering out those people who definitely have the virus, but I mean, from a pure risk management perspective, I don't know if this really adds that much value in preventing the virus from coming into the workplace.
Okay, Dr. Seni, you can go ahead. I see you wanted to mention something.
I just wanted to comment on one of the tools that I used during the screening process, which is the temperature scanner.
Okay.
I have found out that some of those scanners actually are not reliable, and people who are using them, they are just recording whichever temperature, then they record. So it's just a tick box exercise in some of the facilities that I've seen. So I'm not sure how that can be handled, because it looks like it's just a process of saying we've tested, and you can go in, we've tested, we can proceed. Thank you.
No problem. I think, yeah, there's a few options that could be considered as well. I mean, they could have 4 tests, let's say 4 thermal screening thermometers that can be utilized, and check if they were giving more or less the same readings. So based on the one that's the outlier, that one can be removed, let's say. And if it cannot be calibrated, then it should not be utilized. So I'm just throwing in one possible suggestion of how you can only do it, looking at 3 or 4 of them out of the batch, and checking the temperature readings that is coming through. And then also one can also utilize the normal thermometer in the mouth just for a baseline reading, and then test that same person thereafter with the thermometer and see if it matches up with the normal mercury test thermometer, excuse me, as well. So I'm just throwing in a few suggestions of what one can do to verify if the thermometers are functioning correctly or not. Okay,
Yeah.
this is a suggestion.
Fabian, I
anybody
think
else?
this. No, I think this one will take us the whole day.
I agree.
Yeah, because really this screening procedure is a difficult one to really manage. And then employees will also somehow be tempted to not to disclose whether they've got this type of symptoms when they know that they will not be accessed, or they will not access the workplace. But nevertheless, it's okay for now. But it's a vague one, this one.
Okay. All right. Thank you, everybody. Unfortunately, we've stopped at question 11 due to time. Hilton, I know that you said that you have another meeting. I don't know if you got a few extra minutes that you can squeeze in, possibly. If not, I will cut it short.
I can do another five minutes. I can
5 minutes, okay.
Other team as well, but I can do 5 minutes.
Okay. Yeah. I want to try and see. Okay, just sorry, go ahead.
Just on the line, the other day I was doing an inspection on a site. It was a complaint inspection. And then I went through the fever screening, and the screenings were on average 20.1, 20.2, and 20.8. And then obviously, if a medical person will know this is just impossible.
Those people will be dead.
The person who was doing the fever screening, he didn't find anything wrong. And then when I looked at the thermometer, it was set in object. There are 2 settings, object and person. So it was, apart from just being set in the wrong setting, it shows that if you don't appoint the correct person to do these tasks, you end up in some repercussions. Because so if I show that to a medical doctor, he should say all these people should be dead by now.
No, that's true. And then also, so obviously, some of them have Fahrenheit and Celsius, and if you don't explain that to people who are reading high degrees, means it's actually in Celsius, Fahrenheit, excuse me, not Celsius. So yeah, there's some funny ones out there. So I think just quickly on the last one, if I may, because I know a lot of people have been asking me this question. So I'm going to jump to question 21. I'm also getting daily complaints from employees who are reporting their employers not adhering to the social distancing, not providing them with PPE. One employee informed me that 2 colleagues were sick and both tested positive at work, and now the employer is refusing to test their co-workers, and it's business as usual for them. Is there a hotline number provided where employees can report these infringements? Because I know this is asked almost daily to me.
Yeah, there is a hotline number, Fabian. Let me just give it to you quickly. Okay, when I'm looking for the hotline number, because we're running out of time, the most important thing for today's discussion, which we never touched on, was the risk assessment. Right.
Yes.
I saw there were some questions that's surrounding the risk assessment. I just want to say that risk assessment is done in terms of HPA, hazardous biological agents regulation. So that's the most common question we're getting coming in through the Department of Labor. It's your Section 8 risk assessment, but particularly with the hazardous biological agent substance. So that's a bit of a gray area people are not adhering to. And the other one associated with that is your work plan. Your work plan is a prescribed Annexure E on the Disaster Management Act. So, don't make life more difficult. Just adhere to what's prescribed. You've got the work plan, and you still have to do a risk assessment, and then you've got this OHS directive. So I know it's confusing to a lot of employers and employees, but I always say start from the Disaster Management Act, then go to the OHS directive, and then all the other associated guidelines that's released as well. Okay, so that just covers up some of the later on questions with respect to risk assessment that I saw that coming up in the later questions as well. And then somebody asked about the reporting. The reporting is twofold. So it's the Department of Labor and Department of Health. I just can't find this hotline number on my laptop. Okay.
The one is the COVID, the COIDA that needs to be submitted through to you guys. And then the other one is for the Department of Health for notifying him of any person that is suspected of being positive and positive as well. Because that was the 3 points that were on there.
Yeah, the hotline number is 08. You've got it, Fabian?
No.
It's 0800.
Yes.
02.
Yes.
9999.
9999. Okay, thank you very much, Hilton. Appreciate it.
Just my last point before I go. Remember, lots of people asked about reporting. Remember, you have to report it to us. If you read Section 24(1), it also describes illness, somebody who's booked up for more than 40 days. And then you did in conjunction with General Admin Regulation 8, reporting. Remember, if it's an occupational disease, the medical official on this group will also
becomes reportable.
Yeah, Section 25 reported to the Chief Inspector and so forth. So a lot of people ask, why do we have to report it to the department? So those are the references why, and you can make reference to the legality of reporting to the Department of Labor.
Okay. I know time is limited. Just a quick one. How does one determine, okay, that's based on the investigation, but how does one determine really that somebody contracted that COVID at work, or if it was contracted at home or in the public, that it becomes let's say, reportable based on the COVID, under the Compensation Act, the COIDA Act?
Yeah, there was a directive issued by the Compensation Commissioner that indicated specifically how to go about reporting these. Even if it's suspected that it happened in the workplace, there's a criteria to follow, and then remember, they will determine whether it did emanate from the workplace or not through their internal system. And I'm just making reference to this, whoever wants to quickly make reference to it. It's a Department of Labor government notice released on the 20th of March 2020 by the Compensation Commissioner. I'll email this to you, Fabian, as well. So
yes.
And then it's quite a lengthy document. It's a 10-page document answering all of these related to COVID-19 being a workplace occupational incident or disease. And you pull in your normal WCL Remember, normally for the incidents, we pull in the WCL2, but then you pull in the WCL1 together with other documentation, and the compensation commissioner will make the direction as whether it is emanated from work. There's the document, there's a lot of attachments required, and it's self-explanatory on how that should work. But basically, that's for compensation COVID-19 cases.
Okay, perfect. All right. Thank you very much, Hilton, for your time. Thank you, everybody that's participated today. We really appreciated your time and efforts. And I hope that after this, there will be better clarification and less ambiguity amongst the public. And again, if Hilton, if you'll have some time, if you can respond on some of those that we didn't get through, which we can also share on, as I said, on the social platforms, etc., for people's information. And maybe one last request is some of these guidelines could be repealed with replaced ones that we're currently working with. I think that will also help to streamline the process where people are working, let's say, from one library, then from 100 different sources, which is also creating, I think, a lot of ambiguity within the industry at the moment. But as I say, it's information overload from every department and area. But again, thank you, Hilton. Thank you, everybody, for the panel.
Fabian,
Yes,
can I just quickly get in there? Is it possible that we can have more sessions like this in future? I think all of us have so many questions, and I think we need a forum like this to get to all the answers. So would that be possible?
I'll ask the question to Hilton, Pumi, and Thibaut if we can make the gentlemen available. It will be great. It will be great because I think there's a lot of clarification that many people need out there because of all the ambiguity, especially from our friends, the agents, our friends, the PR agents that are coming up with a lot of things that are not required, etc. So,
and especially in terms of, we've got a lot of questions in terms of construction. Now, Hilton and I had a discussion about that, and myself and Pumi, Thibaut as well, and there are so many issues that we need to clarify at this point in time, and our clients out there is not sure what is going on.
That's true. Okay, thank you.
I'm willing to have conversations, especially on the construction. That sector guidelines, I myself promulgated it, and I'm waiting for approval. And it's still open for changes. So even after today's discussion, there are some tweaks that I need to do on that draft construction sector guideline. Remember, it can only get promulgated once we revise the OHS directive, which, as we know, there are some loopholes and ambiguity that we need to sort out. But till then, just we can arrange a similar meeting like this, just in advance, though. And I'm willing to assist where I can.
Thank you very much. Appreciate it.
Thank you, Hilton. Appreciate
it.
Thanks,
I think it's very important to have more meetings like this because a lot of these questions pertain to very small detail things. I'm sitting and wondering whether many of these questions make a difference. That doesn't matter. For instance, who transports a patient from the workplace to the clinic and so forth. So a lot of these questions are very detailed and very nitty-gritty, and I'm just wondering if we're not staring at one tree and missing the whole forest wood. So we need to get these small little debris out of the way so we can discuss the real big issue.
The bigger issues, that's true.
Yeah.
Agreed, Doctor.
Again, any system is well, one has to have a system, and everything in these documents that we're discussing is logical and they're good suggestions, but any system is only as good as its implementability and the way in which you conduct it and its governability. And many of those statements in these documents, although one cannot but agree fully with them, are just not practically implementable on a construction site. The three things that really works is scientifically proven to work well is social distancing, hand washing, and especially wearing of masks. But this is not always possible in a construction workplace. So we need to discuss much more of this, and we need to look at the bigger picture. What are we going to do next year or later this year when a COVID-44 or whatever breaks out, and next year when another one breaks out, and it may be a much more virulent virus than this COVID. COVID's not a serious virus. It's very contagious, but it's not a serious virus. What if a very contagious and very serious deadly virus breaks out? Are we preparing for that? So are we taking rules and decisions that we are making and lessons that we learn from this and building it into a permanent legislation? Such things as social distancing, hand washing, and wearing of masks during winter time. I mean, that can be in permanent legislation and stay there, because that will always improve productivity and will always curb anything from a straightforward mild flu to various serious diseases. But I mean, I think we must have more sessions like this so we can get the small questions out of the way and talk about the big things. Sorry for that speech.
I agree.
Thank you, Dr. Willie. Agreed. Thank you again, everybody. I don't want to take up much more time for Hilton. You see, he has another meeting. So thank you, everybody, once again, and do appreciate your time and efforts. Much appreciated. And with HSE Connection Point, you all is connected. Thank you.
Thank you very much.
Thank you.
Thank you.